So I wanted to talk today really about the spinal galant reflex. I've done some posts on my page about spinal galant a couple of weeks ago, but never managed to do a video to back it up. So I just wanted to talk about it briefly because it's such an important reflex, and I see it so often in children and in adults actually that come into clinic. So, briefly to recap, primitive reflexes are movement patterns exhibited by all babies all over the world. They start in utero and should have fully integrated by about the age of 2. When they don't integrate properly or don't emerge properly, that causes problems with connections in the brain, causes physical problems, emotional problems, all sorts of things. It's amazing the things that we deal with that are affected by retained primitive reflexes, which is why I'm really passionate to be able to explain to people what they are, why we need to address them, and the difference that it makes. So, spinal galant reflex, as the name indicates, it lives in the spine. It runs either side of the lower spine from about just below waist level down towards the top of the buttocks. And its job is to help a baby wriggle out of the birth canal. And when it's retained, it causes a huge amount of irritation around that waist level, and makes children and adults fidgety and wriggly. So where you see children who struggle to sit still, and also children and adults who cannot bear to wear things that are tight around their waist. So people who struggle with things like jeans or wearing belts, or push jeans or trousers very low onto the hips or very high up to the rib cage, they can both be indicators that the spinal galant reflex is still active. Um, and then in children, it makes them very wriggly. It will interfere with the connections in the basal ganglia, which is part of the brain that allows our bodies to be still. So, if the spinal galant is still active, then it's very, very difficult to be still. So, which is why children need to fidget and tap, and why fidget toys can be so useful. And the problem is that when we have children who have those issues and we try and encourage them to sit still or stop fidgeting, what happens then is the child's entire brain power is taken up with trying to sit still, and there is no space left for learning. One of the other problems with the spinal galant reflex is that it causes late bedwetting, where that reflex is still active. If it's brushed at night by the duvet or by pajamas or bed pajamas or nightwear, then that very light touch can on that area of the spine can cause the bladder to release. So that is one of the reasons why we have children with late bedwetting. Similarly, it will cause problems with posture, and as children get older and into adults, because of that instability in the lower spine, it can cause problems where the spine then gets locked, so it can be associated with lower back pain, and even things like irritable bowel syndrome, because of that tension in the muscles of the back can then influence into tension in the bowel. So there's lots and lots of issues around the spinal galant. Also interferes with our ability to focus well and concentrate, because there is that constant need for movement. So lots of issues, and a good movement program will encourage that reflex to integrate. So if that is a problem for you or anyone that you know, then get in touch, come along, we'll do an assessment, we can do you a movement program that'll work for you. And if this is something that you're interested in, either as a parent or as a therapist, then also do get in touch. I'm running some courses in teaching rhythmic movement training, which is the main neurodevelopment program that I use. And it's a really great thing to learn. It's great fun, and it fits really well with any other sort of therapy. So whether it's a talking therapy or whether it's a bodywork therapy, massage, it sits really well where if you're working with people with any kinds of issues really. So now I'm back in the swing of things. I'll try and do another video fairly soon. If you've got any questions, then put them underneath this video, and if you'd like me to talk about anything else, then please get in touch and I'll happily do that. Thanks very much. Bye bye.